Good evening and welcome to Information Please, your Peoria Public Library on the air, and bring you information about your library and your community. This evening, my guest is Tammy Christian from Heartland Healthcare, and we're going to be talking more about the Affordable Health Care Act. Hi, Tammy.
Hi.
This is a busy time because the marketplace just opened, and although the library has already done several Information Please shows about affordable health care and what we're doing, you're going to be using our facilities to do what you do, which is a wonderful thing. And so I really wanted to get you to come on and talk again. It's a big subject, it's a confusing subject, and people need help getting started with all of this. Why don't we start with just tell us again, for some, and I know there's people who don't know, what the Affordable Health Care Act, often called Obamacare, is all about.
Well, a lot of the Affordable Health Care Act has already gone into effect, and people don't realize this. The changes went into effect in 2012 to the people who already have health coverage. The new changes in effect are the Marketplace Exchange, where people can go and compare different types of insurance and purchase it, or see if they qualify for maybe one of the Medicaid expansions that have just
gone through.
Okay. The open enrollment is from October 1st from all the way through March 31st.
Yeah, and that's a first year thing, isn't it?
Yes.
Yeah.
And there will be open enrollment every year between October 1st and December 15th of every year for any changes or anything like that, or anybody who maybe missed the first open enrollment.
First round, or life has changed and insurance needs have changed.
Actually, if there's a life change, they can make that change at any time.
Okay, so what is a life change? Like
birth of a baby, marriage, divorce, loss of essential coverage.
And by that, like you lose your job where you had insurance. Okay. So who should be worried about this? This is the thing, is people don't know, is it me, is it that person? Who needs to worry about who should be enrolling right now?
Well, nobody needs to worry. Basically, if you don't have coverage, we're working with people who are either paying way too much, they're undercovered, meaning they're not covered on enough, or those who just simply do not have insurance. The new Medicaid expansion opening up is going to cover a lot of adults that have never been able to be covered before. Okay. You no longer have to have children in order to qualify starting January 1st. And the income levels are changing a little bit. Okay.
And what happens, this is the part I think people don't get, that this basically says everybody, no matter who you are, must have health coverage. What happens if you don't have health coverage?
Well, if you don't have health coverage, there are a couple things. First off, there is a fee every year that you will have to pay, and that starts off at $95 for the first year, and that's going to go up every year. If there's a good reason, say the affordable care is not, the insurance that's available to you is not affordable, or you've had some kind of life circumstance that's making it to where you can't afford to get coverage, you can file for an exemption, which will mean that you won't have to pay that fee at the end of the year when you file your taxes. Okay,
so there still might be people who don't have health care coverage.
Yes.
And what happens to these folks if they break a leg and they have to go to the emergency room? Then what happens?
Kind of depends. They have to pay their own bill unless they happen to qualify for Medicaid. Maybe they didn't know and they didn't get it. And at some point in the year in Illinois, it's going to be set up to where if they qualify, when they go to the ER, they can make a decision at the hospital if they can be on Medicaid and they will be covered. They have to continue with the qualification and get the material into the Medicaid office, but they can start the process at the hospital.
Okay, so are the hospitals going to have people there that can help them with that?
Yes.
Okay, and is that part of like the group of people, like what's your official title? I know there's 3 different tiers and titles, and it
Right.
depends on where your funding comes from, what your title is. So what's your title?
My title is an outreach and enrollment assister. We're funded through through HRSA grants
Okay.
because we are a federally qualified health center
Okay.
at Heartland, and we're certified as application counselors.
Okay, so you're an application counselor.
Yes.
And that's part of what you're going to do with the library then is people who are just completely befuddled by this. You're going to be at the library like 30 times at Peoria Public. You'll be at the main library and at Lincoln Branch. And I don't know the schedule. Is there an easy way to summarize the schedule?
Absolutely. The first and third Tuesday of every month, we are going
Okay.
to be at the main branch.
Okay.
The second and fourth Tuesday of every month, we're going to be at the Lincoln branch.
Okay.
We are also going to be there the first Saturday of each month from open to close each time.
Okay.
And then in December, because that last Saturday, I believe it's the 14th, before the 15th, we're going to be there as well to help anybody who's last minute, who waited, who wants their coverage to start on January 1st.
Okay, so it's by December 14th you have to have enrolled so that your coverage starts January 1st.
It's the 15th.
The 15th, but,
But-
you're doing it on the 14th.
Yes.
They could still do it from home.
Yes,
on the
anybody
15th.
can sign up from home on their computer.
Yeah, and we have put together a portal on our webpage. It's under our research, all databases, that if you go to, we have compiled the various links you need because I personally, and I know the other librarians worry about people being scammed. And we're worried we were already warned that there's a website that's very similar to the proper one. I think it's a .com instead of .gov or something. Very similar, so easy to lose your way. So what we've put at peoriapubliclibrary.org is this portal, and we are keeping it constantly updated with new information. We have the link you need to apply. We have various, helping things, and we have the schedule of your I don't know what we're calling them. What are those?
We're doing an information session, but we're also helping people on the computers,
Right.
who have questions or anything like that.
So sort of like an all-day seminar information bonanza.
And they can just come whenever they want to if
You
they
don't
work.
need to schedule an appointment.
Right. You can come in, and some people will need an appointment because they'll need more one-on-one. If they're completely befuddled and they need us to just
Stand
sit
by
down
your
with
elbow.
them,
Right.
then we'll set up individual appointments with people.
Okay. But the great thing is you're in our lovely computer lab, so it's easy to get to. You just come in the front door, take the front elevator. Sometimes people don't know we have a front elevator, but we do. Take it down, go down the hall, and there's our big, beautiful, comfortable computer lab with, kind of state-of-the-art equipment. And at Lincoln Branch, it's just big, bright, sunny room at the back and a pleasant place to do something that may be, like doing taxes, not as great.
Yeah.
But before they come, it's really important. I've got this marketplace application checklist, the things you need to bring. So let's maybe go over those. So
Okay.
when people walk in the door, you're not sending them back home right away to get
Right.
their papers. So we've got
We need-
Social Security.
Yeah, I'm sorry.
Go ahead. No, go ahead.
We do need your social security number. That is very important. If you happen to be an immigrant and your children qualify, there are situations where the parents may not qualify, but the children do, then you don't have to have the social security number. But we will need ways to identify your children. We also need employer and income information for each person in the household. That can be W-2s, wage statements, pay stubs, things like that. You need a mailing address. They've made it easier for some of our homeless population by not expecting them to have a physical address. So if they have a place that something can be mailed to them, we can use that. They just have to be able to receive mail there.
Yeah, we have some shelters that will act as a mail drop, more or less, for homeless people who stay
Right.
there occasionally.
And sometimes the churches and things like
Yeah.
that will too. Also, they need policy numbers for any insurance they currently have, so that we can make sure that they get what they qualify for.
Right. I should go back and warn people that you cannot use the public library as your address if you don't have a physical address. That's one thing we don't do. So if you need to think about that ahead of time, you may want to think about that. Talk to a church, a shelter, another family member, somebody to have an address where you know you can get that.
Right.
Okay, and here we've got more stuff you need to bring.
The policy numbers, I did mention that, of the current health insurance. And then the employer coverage tool. That's for if you have a job-based plan that's offered. Some of the time you won't qualify for the marketplace, but the reasoning for that is usually because it's going to be less expensive for you to keep your employer coverage than to get to apply on the marketplace exchange.
Aren't there some subsidies available too?
Yes, there
to
are.
help pay for
There are-
insurance if your employer insurance is too expensive? That's what I understood.
Not for the employer. Well,
Okay.
You have to purchase insurance through the the market exchange in order to get those. But anybody who purchases through the market exchange, if their income, if they qualify because of their income, they can get tax credits, and those can be applied monthly directly to your insurance premiums, or you can wait until the end of the year and get them back. And just like any kind of tax return. One of the things I do want to point out, though, is if you do the monthly and you estimate your income too low, you could end up paying back at the end of the year. So it's very important that if there are any income changes or anything during the year, that you make those changes.
Stay on top of that.
Yes.
Okay. So if somebody works for a small business and they're offered insurance, but it's terrible insurance and it's really expensive, if they have that coverage, are they still allowed to go to the marketplace and look for coverage?
Anybody can go and look. You don't even have to sign up for an account to just check the different plans. But you can go on there and sign up for the you can sign up and find out if you do qualify. Anybody can.
Okay. The threat, it's the law.
Yes.
That's my threat slide. Required to have health insurance by January 1st, it's the law. Yeah. So that's one thing that I don't think is a message that's gotten out to everyone. But let's talk a little bit about the marketplace itself. And it sounds scary. It sounds like we're going to Amazon and there's 9 million choices. And how can people be sure that going through this marketplace, they're not just going to end up wasting their money? Or, what is this all about? And who's allowed to sell insurance through there? Anybody who wants to?
It's actually, they have to be approved by the state in order to be on the marketplace. We do have a list of proposed insurance companies that are on there. And they had to go through a pretty rigorous process to go through that, and they had to make sure that they had to offer certain things with their insurance plans, and they also had to agree that they had to charge the same premium for people on the exchange as they do for people who buy through them privately.
Okay.
So
they can't charge more.
Right.
Okay.
It has to be the same price, and that helps keep costs down on both sides, because you're not required to purchase your health insurance through the marketplace exchange. Some people think that you do, but you don't.
Go that way.
And unless you want the tax credits.
Okay.
And so that just kind of depends on your income and what you want. The exchange does put everything side by side, so it's very easy to compare the different plans to make a choice that's more informed than if you were to go and go to separate insurance companies
by yourself and just shop around, which could be really time consuming.
Yes.
And the other thing that's interesting is there's an insurance co-op that insurance is available through. What's that all about?
We haven't really learned a lot about that, but it is put together through the state. And We just heard the first about it yesterday, actually.
Okay, well, I may know more then. What I know, and because I was able, all the librarians were able to hear the head of that co-op speak, and the co-op was actually formed by some major hospitals and healthcare groups, from what I understand, and nobody makes a profit. It's like when you think of a food co-op where everybody puts in a little and gets some back, and they expect this to be very affordable, and it's a not-for-profit insurance company, a co-op, and so they're offering the same types of insurance that for-profit companies are, but nobody makes any money off of it, and it provides that same coverage. But I know there's also various levels of
Yes.
plans you can buy. So do you want to talk about
Sure.
that a little bit?
They are called the metal levels. There are 4 of them.
Okay, I thought
and
there was 3.
There are 4, and they're different. I mean, the coverage is different. They have several plans within each. Basically, we have the bronze, silver, gold, and platinum.
Okay.
Bronze is 60/40. The insurance company pays 60%, and the person who's insured pays 40. Where silver is 70/30. And I will mention that for the tax breaks and the cost sharing breaks, you have to have at least a silver plan. With the silver plan, the insurance company pays 70%, and you pay 30. With gold, it's 80/20, and platinum is the highest level, so it's going to cost more. That one's 90% and 10%.
Okay. And with any of these, can you attach the healthcare savings account, which was another way? I know a lot of businesses offer the high deductible plans, and then you can have the health savings account where you're putting money that belongs to you but can only be used for healthcare, so that you have money. Can you do that with any of these plans?
That's a good question. I haven't had that question yet. I know that you can get that through your employers.
Okay.
I'm not sure if they're going to have that through the marketplace or not.
I just wondered when you had the 60/40, and that almost seems like, do all these plans have the same deductible, or like does the bronze has a higher deductible than the silver?
Actually, the deductible has nothing to do with where they're at.
Okay.
You can change your deductible to be higher or lower to control your cost, your monthly cost. Same with your...
Same thing you do with car insurance,
Yeah.
or your house insurance.
Absolutely.
You put a higher, like $1,000 deductible, so if you get in a fender bender, you're probably going to have to pay for it out of your pocket.
Right.
Yeah.
Right.
There are no healthcare savings accounts for cars, I don't think. But that would be handy.
That would be.
Okay, and so my feeling is that people will come to the library, and the ones who don't have somebody helping them are going to sit down with all this stuff and be pretty overwhelmed, because unless people, we see this with taxes, where folks, unless they have the really simple plug in 2 numbers and you're done tax form, are pretty well overwhelmed. So,
Right.
and so that's what you're going to be there to do.
Absolutely, to answer any questions and help in any way we can.
Okay.
And a lot of people are just simply scared of it. People don't understand it. There's not been a lot of information out there readily available. So, of course, people are going to...
And do you have any idea why that is? Because I think everybody wonders, why is there no information? This thing, it's being implemented right now, but nobody knows what it is, but you've only got this little bit of a time to do it.
Well, I think they've been working out the details as we go and making sure that everything runs smoothly before they move on to the next detail. As they get it, they are releasing it, and they're releasing what they can.
Yeah, as they can. Well, and I'm sure that what folks hear in the news about the political process with everything else is not helping at all to clarify. And so you have to sort out what's opinion, what's fact, what should I be doing. And I don't think anybody's really clear, but I guess what we can say is come and talk to you, come and talk to, or look at the web portal if you want to get started. We have a lot of articles and information, links, I think, to everybody who can provide some information to tell folks about it. And so then when people start paying for this, how will they pay for it? I mean, is this the kind of thing you have to go to somebody's office and give them a check, or what?
Actually, the first payment you can pay through the marketplace. After that, you work that out with the insurance company. You can go with a check with some of them you can mail it, some of them you can do, you know,
Automatic
automatic
withdrawal.
withdrawal, things like that. It just depends on how the insurance company wants to handle that. And that should be right on the marketplace. When they apply, it should tell them the ways that they can.
Exactly what they
Okay.
can do. And I'm sure there's a lot of people who have fears of, okay, I get started with this and then come May, I can't make my payment. And that may be information you don't have either, but
Right.
is there, I mean, I don't know what happens to people then where they tried to get insurance and couldn't keep up with it or afford it, or made bad budgeting choices, or,
Right.
you know,
Well, I mean,
somebody
that's-
gets, you know, somebody gets in a car accident and you got to buy the car to go to work.
Right. Well, I mean, there are going to be things like that that come up. That will be something that you work out with the insurance company as well.
Okay.
The marketplace is just a place for you to compare plans and figure out what you want and get your tax credits. Beyond
Okay.
that, it's between you and the insurance company. I do believe most of them will have a grace period.
Okay. So then, is your organization going to do any educating about how to shop for insurance? Like how to help people make decisions?
We can't help them make decisions. We can inform them and help them and let them make their own choices.
Right. What kind of information will you provide when somebody says, I have no idea whether I need a bronze plan or a silver plan? What are some of the informational things you can tell people that they can then consider as they make their choice?
What we can do is we can go over the plans that are available to them, and just let them. We need to find out what coverage they need. Do they have diabetes or some sort of illness that they need? Do they have a doctor that they want to stick with? You're not going to. There is a common misconception that you won't be able to keep your doctor. That's not true. You may just have to get an insurance plan that they are included in. But it just depends what it is they're looking for. What we will do is we can help them compare and we can show them what's covered and let them make the choice.
Okay. Yeah, that's I think the fear that the librarians have, is that we have people who don't understand and they want us to help them choose, and we can't do that. All we can do is provide information,
Right.
and so you can decide for yourselves. Now, you mentioned early on Medicaid expansion. Do you want to illuminate that subject a little more?
Okay. Actually, there are a lot of people that are going to be covered through the Medicaid expansion. I would say probably, well, a large portion of our homeless population will be able to be covered. You don't have to have dependent children. The income levels have gone up to 138% for some groups of the federal poverty level.
Do you happen to know what that is right now?
I know.
It changes all the time.
I don't actually. I do know for the tax credits, it's 400% of the national or the federal poverty level, and for a family of 4, that's just slightly over $94,000 a year. So there'll be a lot of people getting those.
Yeah.
I'm not exactly sure what the poverty levels are at
Yeah.
this
I
point.
used to know those things.
We have them available in a book. I just don't have them here.
Yeah, I don't have them here, and that's something that I think we probably have on our website too, in our information, so people can look right away and get an idea. Where am I with all of this?
I think they said about 95% of people who are not insured will either qualify for tax credits or Medicaid. So there aren't going to be very many people who are going to be paying full price for their insurance.
Okay. And that's when we get into the political part. So we'll leave that subject.
Yes.
Tell me, if you're doing this at the library, would you like to tell us where else people can find you and get information if the library or that day or time isn't their cup of tea?
Well, they can call us at Heartland Community Clinic. I don't have that phone number with me right
That's
now,
okay.
but
we can put it on our website.
Absolutely. Or they can, we will be in Pekin at the Pekin Library every other Wednesday starting, I believe it's the 9th, from noon to 8 p.m.
Okay.
We will also, one day a month, we will be at Workforce Network
Okay.
from 1 to 5. That's usually going to be a Thursday towards the middle of the month. And we'll have flyers and things out and available for people.
Okay, so you're pretty much doing this Peoria,
Peoria,
Tazewell County, but there's other organizations that are covering everywhere.
Yes.
And there's no competition between you, right? Your whole goal is to get that information out.
Right. That's the thing. And we have talked about working with the people at the health department and things like that, because there are several people in the area that are available for help.
Yes, I was able to speak with Diana Scott, who's the public relations person for the health department, and she was telling me that they're going to offer a lot of help. Walk in, make an appointment, come into the health department. And so I think that's going to be available, you know. They won't have like the big labs like we do where you can help a whole lot of people at once, but they may have more flexibility and time for people who have trouble getting somewhere. The beauty of having Main Library and Lincoln Branch available is that, you know, you can take the bus there if you're worried about transportation.
Right.
We're accessible for people who have mobility issues. We have elevators. We have, you know, accessible parking lots. Very easy to get in and out of. So.
And we all just have this. We all have the same goal: to get the word out and get people insured.
Get people insured so they can get good health care.
Yes.
Tammy, thanks so much for taking time out of your day. Now you're busy, you got a lot of people to see, a lot of people to help. So I'm glad. I hope that getting this information out here on our little TV show and on YouTube will help people. And of course, we'll see you often at the library in the months to come. So thanks.
Thank you.
You can find all the information you need about the Affordable Health Care Act and what you personally need to do on our website at peoriapubliclibrary.org. And Tammy and her co-workers will be at the library in our computer labs. We have that scheduled up on our website. You can call the library and ask when the next time is or times, and we will be glad to get you all the information that you need. You bring your information and you can get signed up and have your health care. Thanks for watching. We'll see you next week on Information Please.